Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over eating disorders. So, this is kind of an understudied disorder, which about 5% of Americans actually have. And this is quite alarming because it causes a lot of side effects in terms of even bone defects and calcium deficiencies and a lot of vitamins and minerals, which are essential to our bodies, are depleted within our body. So, what are the types of eating disorders that are quite frequent? One of them is, of course, bulimia, and then another one is anorexia nervosa. Of course, in my medical training, I did learn about these from the DSM criteria and looked over these. But it's good to revisit this, and I think the general public needs to know some of the symptoms that are associated with eating disorders. So the also binge eating disorder and avoidant restrictive food intake disorder are others specified have been included along with the anorexia nervosa and bulimia. Bulimia nervosa is another term. So again, eating disorders, like I said, affects about 5% of the population, and more common in girls and women rather than boys and men. However, they are affecting gender, body sizes, age, socioeconomic status, and race and ethnic identities. So you can't tell by a person's appearance whether they have an eating disorder. And that's what is alarming and sad that you can't really tell. And so people would be walking in normal and have eating disorders. Um, and so this has a relationship between disordered relationship between food and our body shape and weight that drives compulsive disorders such as restrictive eating, avoiding certain foods, binge eating, self-induced vomiting, laxative misuse, or excessive exercise. Um, so our current understanding, biological, physical, and psychological, shows that there's also some genetic components that is associated with this. This is, by the way, psychiatry.org, where you can find more information about OCD and also eating disorders, which is kind of connected, surprisingly, with obsessive compulsive disorder. Um, so, if several of these items are seen, it may be cause for concern. So changes in eating and diet, avoiding abruptly changes in diet and foods that are enjoyed. Um, Also, changes in exercise and movement, having to exercise in order to earn food. That is something of a concern. And then changes in behavior, avoiding eating in front of others, changes in mood, increased irritability without a clear cause, common physical symptoms such as fainting or lightheadedness, GI symptoms, loss of menses, or unexplained weight loss. I'm not going to go over this whole page, but it's important to note. I think these percentages are important. Like for instance, anorexia nervosa is among the most lethal psychiatric diagnoses, with suicide accounting for up to 44% of deaths. So this is kind of a very kind of like a continuum. It doesn't necessarily just end with anorexia nervosa and not eating adequately, but also has other mental health repercussions. Um, so that's a lot of the symptoms and a lot of the side effects of this include brittle hair nails, muscle weakness, heartburn or reflux, sudden cardiac arrest. So these can be very deadly. And so this goes into binge eating, bulimia, avoidant restrictive, and really goes into treatment, and it's called a FREED, avoidant restrictive food intake disorder. And then pica or pica. Pica is where people start eating metal, pebbles, charcoal, or clay, and even so, paint chips. So these are for all the deficiencies that might take place in a lot of times is part of normal development among people under age of 2. Um, and so some of the rumination disorder and other specified feeding and disorder, eating disorder. So the Hopkins and VCU Health has more information on this, and there's more information in NEDA, National Eating Disorders Association, and others. So I wanted to kind of go over the eating disorder test, but I think this is very important topic to be considered in terms of the symptoms that are associated with this. So, in a nutshell, these are what eating disorders entail. I hope this has made some sense. Thank you for listening.